Hello and welcome to the Swallows Charity Head and Neck Cancer Podcast. Join us on a head and neck cancer journey, presented by Derek Luthwaite.
Hello everybody.
And Chris Curtis.
Hello everyone.
We'll be discussing everything that patients and caregivers need to know about diagnosis, treatment, and so much more.
I'm CEO of the Swallows Head and Neck Cancer Charity, and I'm also a cancer survivor for nearly 10 years now.
And I became a caregiver when my wife was diagnosed with mouth cancer, and it certainly put me on a journey that I never expected to experience during my lifetime.
The Swallows Charity Head and Neck Cancer Podcast is designed to help and support both patients and caregivers.
Hello everybody and welcome to the Swallows Podcast. My name is Derek and today I'm here with Chris. Now, sadly, Chris represents the patient point of view and I represent the caregiver point of view. So Chris and I don't always see eye to eye. That's true, isn't it, Chris?
We see eye to eye all the time, Derek.
Today, Chris and I are going to be looking at life before cancer, awareness. We've got two areas I believe we need to touch on. We've got the area of you as a patient discovering something, and then of course the impact that has on your immediate family members when you utter those magic words, I think I found a lump, or some such comment. So what happened with you, Chris? How did it all happen for you?
I started to get a bit tired. In fact, it became a family and a friend joke that, you know, if you come around to our house, all the lights went off at 8 o'clock and it was time to go home because I was asleep. So I started to get very, very tired and started to fall asleep. I then started to find a little bit of a lump on my neck on my left-hand side. And I just felt this lump getting a little bit bigger and bigger. And then you start shaving. So when you shave and you start to shave over the lump, it was that point then I said to Sharon, what do you think this is? And, you know, Sharon being Sharon, everything is positive, everything is fine. Go to the doctors and they'll tell you what's wrong with you. Don't, you know, it's not a second guessing game. So eventually we made an appointment for the GP, and then the rest is history.
Okay, so prior to that, you were a pretty active chap. I mean, unlike now, where you just sit in the chair all day long, flapping at the lips and giving us all your wisdom. But you used to be a fairly active guy, as I understand.
Yeah, I used to referee, used to play golf.
You used to referee?
Yeah.
I have another reason to hate you now.
Yeah, but refereeing with the proper ball, which is the round one, not one of those funny shaped ones that bounce everywhere.
Yeah, okay, whatever.
So I used to referee most Saturdays and Sundays, refereed at a high standard, and I used to go golfing when I was allowed out to play. So, I pretty active. I was 22 stone, if you can be active at 22 stone. But I enjoyed life. Everything was good. You know, I think the week before that I got diagnosed, I was at the races for the Grand National, and I've actually got a picture with the lump that's there. And you know, even our friends that went with us remember that event was just before me getting diagnosed. So you know, it was the last thing I was expecting. I'll tell you that now. Okay,
let me ask you a quick question here, Chris. The period you're before you even sort of noticed the lump, are you you're refereeing, you're doing your walks, you're taking the dog out, etc., etc. Are you aware? Are you even aware of cancer at this point in time of your life, or is this something that just happens to other people?
No, cancer has always been in my family. So my goddaughter died at the age of 19, 20. So my dad had cancer. My brothers have had cancer. So cancer was all round our family. So I was aware of it, but I was always supporting people. So it was never going to happen to me. You know, you get 5 siblings, you wouldn't expect 4 of them to get cancer. And that's what happened to our family. So, but also the cancer I've only ever known is people that die. So, when they told me I'd got cancer, the first thing that come into my head wrongly was, I'm going to die because I got given cancer. So, but before that, answer to your question, no, it was never going to happen to me.
Interestingly enough, from my own perspective as a caregiver, of course, I had very little awareness of cancer within my own immediate family until 3 years before my wife Jane was diagnosed, when her aunt died from cancer, her mother died from cancer, and her youngest sister passed away with cancer, all in the space of 3 years. When Jane was diagnosed as the fourth member of this group with cancer, her immediate response was not dissimilar to yours. This is a death sentence. But for me, it was, here's a battle. Here's something we can fight. Let's take this one head on. And I know it's easy as a caregiver because you haven't got the disease. So it's a little bit easier because it's not impacting you personally. But I tell you what, it was still a shock when she got diagnosed, but I blocked out all the negatives and went down the we're going to fight this and we're going to beat it approach.
Which I think is great, Derek. But that's, that's what you're like, even to this day. That's your makeup. And I have to say, before my cancer, that's what I would have said if you'd have asked me the question before I had cancer, how will you deal with it? I'll say it'll be a battle and I'll beat it. And I will take it headlong and I'll be just like you. But I wasn't when it was me. And do you know what? I think, God forbid it ever happened to Sharon, I'd be exactly like you are. I would fight it and I would make sure we beat it. But something happens inside that makes you go two ways. One is you become that fighter. And if you listen to some of our previous podcasts with a guy called Paul, he's a hell of a fighter. He's a guy that is now going to take this thing on, and God forbid anything gets in his way, he'll beat it. But then I'm just talking to a patient at the moment who is just like I was. What makes us do that? Who knows? I wish I knew why I was being like. I went in this big cancer bubble, and as long as I was in that bubble, I was safe, and nobody was going to get in that bubble. Why? I don't know why. We can deal with that in some of the other subjects, but the awareness is, to me, the awareness happens before any of that happens. And I think it's important people understand what the signs are. And that goes for everybody, because at the moment there will be
You're
people
listening to the Swallows Charity Head and Neck Cancer Podcast.
And they're married. Now, unless they've got a crystal ball, they don't know which one they're going to be. They're either going to be a caregiver or they're going to be the cancer person. But at this stage, all they can look for are the signs. And hopefully they go through their life and never find the signs. That's the ultimate. But at this moment, they don't know which one the gun is going to turn to.
What should we be telling people, Chris? Should we be advising them to be doing self checks? Should we be advising them to make sure those dental appointments include oral cancer checks? What's just a couple of simple guidelines that we can say to people? If you do this, hopefully, if you've got it, you might catch it sooner rather than later.
Yeah. So there are 8 warning signs, and you can have one of them or a combination of them, and you only need one of them for a longer period than 2 weeks. I don't know how long COVID is going to be, and I don't know when you're listening to this. It could be years down the line you suddenly come across this podcast. But just because you get one of these, you do not stay at home. You get yourself to a GP or a dentist and you get examined. So the first one is a persistent sore throat. So if you've got a sore throat that lasts longer than 2 weeks, and no matter what you do to that sore throat, it doesn't go away.
You've taken the old cough medicine, you've tried the lozenges, and it's still there.
And it's still there. It doesn't have to be a sore throat that hurts. You just know that something is not, you get to know your body.
Yeah.
Certainly when you get to your age, Derek, you've lived a lot of years, so you understand your body. But, us youngsters don't really get to that stage yet. But, it's a persistent sore throat, not a hurting one, but something's not right.
Okay. So that's number one, sore throat.
So the next one is the one I think you should really go to the doctors for now, because I've been in your company. So foul breath.
Thank you, Chris.
So foul breath, if that stays there for longer than 2 weeks, then, please, again, just go to the doctors or you go to the dentist. And it could end up just being a rotten tooth. It could end up just being that you need extra toothpaste to help you deal with that foul breath.
I think it's really important here, Chris, that we must say to people, please do not get sensitive about somebody saying that you've got a bit of a smelly breath. This could be saving your life. This potentially could save your life, this information, because as an individual, you don't always notice it yourself. You need somebody else to say, you've got a little issue there.
So we had a gentleman that unfortunately lost his battle, started with the foul breath. And within 8 weeks, it had gone to a tumour coming outside his mouth. And it was his friend that got him there by saying one morning, your breath stinks. I'm going to take you to the hospital. And the rest is history. So, yeah, you're right, Derek. Foul breath, don't be scared to say something. So hoarseness and voice changes. If your voice starts to become a bit hoarse, the problem with hoarseness is it happens over time. So it's not like you suddenly have a really nice voice today like mine, and then tomorrow you wake up and you've got a hoarse voice like yours, Derek. The other one is swelling of the throat. Again, that could go with your sore throat, but it might not do. But if your throat starts to swell and then goes down and then swells again, swelling of the throat could be.
Was that a symptom that you had, Chris?
I did, but I didn't know it.
Okay, that's obviously because of the swelling of the head that went along with the neck. You didn't notice the difference.
Correct.
Okay.
So anyway, we'll move on. We'll cut that out afterwards. So this is the one that we always do when we're doing this podcast. I get this all the time: persistent earache and a constant pain. So if you get this, just think that's the Derek sign: persistent earache and a constant pain. If you get that all the time, then again, get yourself there. This is all 2 weeks. The other one, lumps, bumps, and a big mass without pain.
And how are you going to spot those, Chris? I mean, should we be standing in front of the mirror every morning when we're washing, shaving?
Listen, these are the most important things we will ever do in this podcast for the whole entirety of this podcast. As you do every morning, and I know you do, to get that beard right, you stand in front of the mirror and you open your mouth, which you won't have a problem with, and you look for white and red patches. So you look inside your mouth, under your tongue for red, and you move your tongue, your mouth to one side, your skin to one side, and you look for red and white patches. But also at the same time, if you're a man and you're shaving, just feel your neck and around the throat and around the back for any lumps that are staying there. If you're a lady and you're putting your makeup on, have a look at doing your bumps and lumps then. And then the last one, which is a persistent nasal obstruction. And again, that could be polyps, but it might not be. It could be a lot of things. It might just be that you don't like blowing your nose properly. Or if you blow your nose, it never feels like it's cleaned. They're the sort of things that you should be looking for. So it's 8 simple little things to look for.
Can I just cover one other area with you, Chris? It's a question that I've been asked a number of times, and you may or may not know the answer, but particularly for any form of mouth cancer, what impact do mouth ulcers play in terms of detecting whether or not you might have something that needs to be going to get checked?
The dentist will always look for mouth ulcers, and mouth ulcers, a lot of people have mouth ulcers, and they also have mouth thrush. They are signs that it could be linked to some sort of cancer, and it's worth getting checked out. It might end up being, no, you've got ulcers, take this medicine and everything's fine. Or it might be that you'll end up going to the hospital just to have it checked out. But ulcers, again, if they're there for longer than 2 weeks and won't go away, get it checked. The other one is not so much an ulcer, but whenever you're eating and sometimes you bite your tongue or you bite your chin inside, and you think, ow, that hurt.
Yeah.
Well, if you do that on a regular basis, then it's worth getting that checked, because it could be something growing there that you're catching that you haven't had before.
Oh yeah, I never thought about that. That's a good point. Yeah.
So that's like a lump or a bump.
Yeah.
But you won't think it is. You'll just think, oh, I've caught it again. But if you do it once, it's fine. You've rushed it but if you continuously do that, it's worth getting it checked out. It might be nothing, but it could be a bump that is growing, that is now engaging with your teeth.
So, Chris, the message: if in doubt, get it checked out.
Hey, that's good. We could use that one, Derek.
It's better to be told 20 times there's nothing wrong than miss one potential cancer cause. Don't be afraid. If you think you've got something, if you think you've got a lump, a bump, if you think you've got a growth, if you've got persistent earache, as I have with Chris, if you get persistent smelly breath, all the things that Chris has talked about before, it's really, really important. If it's persisted for 2 weeks or more, make that appointment with your GP and let them make a decision as to whether or not there's something more serious here. That hopefully 99 times out of 100 there won't be, but it's better to make sure.
Yeah, and the earlier you get diagnosed, the better chance you've got of surviving this. Because if you can get diagnosed at stage 1 or stage 2, and we'll talk about stages in another podcast, but if you can get diagnosed at 1 and 2, there's every chance you'll survive this cancer. If you get diagnosed at 3 and 4, your chances become less. But you can go from a 1, a 2, and a 3 in a matter of days. It doesn't take months to go from a stage 1 and a 2 to a 3 and a 4. It can happen in days. So It's important, as soon as you feel it or understand something, then you go. When you ring up that GP and say, I want to see a doctor, and you normally get that wonderful receptionist who sits at the desk and says, do you know what, you can come in 2023 at 3 o'clock on the 13th of November, because that's the next time he's free. Then you say, no, I think I have a cancer that is one of the signs. That word cancer possible will get you an appointment instantly. Whereas if you just say, I've got an ulcer, or I'm biting my chin, they'll say, well, that's not priority. You've got to say that you're aware of the signs for cancer and you want to be examined for cancer.
That's frightening, Chris. Are you suggesting that there is diagnosis by receptionists going on here?
Not so much diagnosis by receptionists, but they will have a list, and we all know they are busy people. So,
yeah.
But the worst thing is, you could say, okay, we'll get the GP to triage me. So the GP will ring you before you're brought in. But you've got to give them that word that possibly you may think you have one of those signs that could be cancer. So I want to talk to someone now.
Okay.
It just gets you past that wonderful gatekeeper that is, because we know people just go to the GP for the sake of going to the GP. We know people go to the GP and then don't turn up when they make the appointment. These receptionists have a hard job. So do the GPs. So you've got to just give them a little bit of a nudge. And that's the nudge to say, I've heard about a diagnosis. I think I might have had one of those that's lasted longer than 2 weeks. I'd like to see a doctor ASAP.
Okay, so the message here, people, is under all circumstances, be as forceful as you need to be to get in front of the GP to get yourself checked out. That's the big message.
Or
Chris,
your dentist.
Or your dentist. Absolutely right, Chris. Yeah, and or your dentist. One other area, and I know this is close to you because you've done a lot of work on this, and I know we're going to do some follow up on this in another episode. But Chris, just take us through the headlines of what a lot of people may not know. about, and that's the HPV virus.
Yeah, HPV is, everybody has HPV. Everyone has the human papillomavirus in their body. It's just we all have it. So for ulcers, or you have athlete's foot, or you have rashes on your feet, that's HPV. What normally happens then is your body, your immune system fights it off and it goes. Not a problem. The problem with the HPV that turns to cancer is it's a viral, so it's in the air. No one really knows what the switch is to make it become cancer. It's sexually transmitted, and it's, instead of your body being able to fight it, it can't fight it, and it will then turn to cancer. And girls' HPV is in the cervical area, and they have their jabs every year for that. With men, it ends up in the throat. So totally different parts of the body, different ends of the body. But the good thing about it is if you get diagnosed with HPV positive, actually, that's a good sign, because more people survive that cancer than any other cancer. You've more chance if it's diagnosed early of surviving it. The Swallows was part of a big campaign to get our boys vaccinated. And we won that battle 2 years ago. Now all boys at the age of 12 in September, when they go back to school, get offered the vaccine. And if anybody wants to understand more from a parent's point of view, we have a great brochure that if they email to us, we can send out one of our brochures that's been written by a professor. And that professor is going to come and talk to us more.
I'm sure there will be a lot of people scratching their head going, despite the fact that this has been around for millennia and it affects all of us, there'll still be a lot of people scratching it. I have to admit, until I met you guys at the Swallows and started talking to you, I knew nothing about HPV. Yeah. It was a subject that I had no awareness of whatsoever. So it's really, really important that people are made aware.
Yeah, I got diagnosed in my early 50s, and I was told my cancer started in my 30s, and it just lays dormant, because that's what happens with HPV, and then it comes out, and it was in the sort of 50s onwards group. Now, because youngsters are sexually active a lot earlier than they were when me and you were young, Derek, which was a lot of years ago, it's naturally, if you're not actively sexually until your older age, then the cancer will be an older age, because it's that gap. So if you're sexually active early, then the cancer will come early. So we're now getting patients of 30 and 40 coming up with head and neck cancer, whereas that's only happened over the last 10 years. And that's frightening.
It is indeed.
So people need to understand that when your boys are being offered that vaccine, you need to understand you could be saving their life from their age 30 onwards. Once they are sexually active, it's too late for the vaccine.
That's interesting. So it's take the jab now, a bit like COVID. Take the jab now and prevent the future from going wrong. Yeah.
Yeah. Once you are sexually active, you can have the injection. It may help, it may not. But the professional advice is really, you've let the horse run out of the stable. It's too late.
Okay. All right, Chris. Well, I'm sure we'll have a lot of interest on that particular subject, and we will treat it in a lot more detail on a future episode.
You're listening to the Swallows Charity Head and Neck Cancer Podcast.
Now, listen up. We're going to cover today the traumatic experience, the diagnosis. So this is the point at which you find out for the first time that cancer is involved. So my first question to you, Chris, is how did you find out you had cancer?
The bit that got me was when I even had the biopsy first, and I still didn't think I had anything wrong with me when I had biopsy done. But then we went back, and I still thought they were going to tell me that I'd got swollen glands or something that had gone wrong, and you're fine, Chris, go away, and off you go. But when we walked in that room and there was all those people there, I thought, oh my God, something's not right here. And I sat down in that damn big chair of Mr. Nygam's, and he just looked me straight in the eye and told me I had cancer. And oh my God, my world come to an end at that moment. And I have to say, from that moment onwards, I can't remember much, Derek, to be fair.
Did you feel yourself sort of shutting down, Chris, at that point, as if you were in a dream world and this can't be happening to me? Was that the sort of feeling you felt?
The only way I've always explained it is there was all these people talking to me, and I was trying to take all this information in, and my brain just said, enough's enough, shut down. And I shut down. And from that moment onwards, for a couple of 3 days, I can't remember anything. It took me almost 5 years to remember those 3 days again.
Okay, from a caregiver point of view, it was slightly different for me. I was outside the room, and my wife had gone in a bit like you. She had the biopsy some time before, and she was now with the consultant. And I'm sitting outside in the waiting room. And I'm reading the newspaper, I'm doing the crossword, I'm doing anything to keep my mind off what may or may not be going on here. And I'm thinking to myself, in my background of my head, I'm thinking, I hope I don't get called in. I hope I don't get called in, because I know if I get called in, it's the worst possible decision. And just at that moment, the door opened and a face popped out and wagged a finger. You know, the old come and join us sign. And I just had a flood of dread go through me, because without having been told anything, I just knew I was about to receive the worst news of my life. But me being me, full of bravado, big smile on the face, buff it all up, I stomped in there and I sat down and I said, okay, folks, what's the story? And my wife looked at me and she said, the doctor didn't say anything. She said, it's cancer. And my immediate reaction was, right, we've got a fight on now. We've got a battle here. I've got to be tough. I've got to be strong. I've got to be brave. I've got to take the lead. And I said, okay, that's okay. All right, we've got the decision. What's our next step? And I got straight into action and activity. I guess from what you're saying, Chris, that was absolutely never going to happen for you, and for you receiving that information.
It's strange that you as a caregiver, that's the bit that you done. And I wonder how Jane, your wife, felt at that stage. Wonder if she was like me, where her brain was going around. And, I was lucky I had Sharon in with me at the time. So I think Sharon took the lead from that moment on, a bit like you did. I was like in that chair, like I said, and it was all going above me. Yet Sharon suddenly become that strong one that suddenly took charge. The problem she had was, right from day one, it was about me and not her. And as much as she was trying to ask questions, even the answers were aimed at me. And I felt, that was not right. So, Derek, do you feel that you got diagnosed that day? Because, patients get diagnosed, but Sharon sometimes feels that she got diagnosed that day, but diagnosed as a carer, as a caregiver. So, and she feels that her world changed at the same time, good, bad, or indifferent. And I feel that, this is a partnership. I know that me and you have a bit of banter about this, but this is a little bit about a partnership going through that journey. And, some people don't have that support. So, I feel that we all get diagnosed in that room that day. And it's how we then deal with that journey.
I don't think I recognize that diagnosis, Chris, to be honest with you. I've always been sort of pragmatic in my approach to virtually everything. I see everything as a hurdle, and then I look for the opportunity to try and climb over it or break through it. I mean, I love the breaking through system. You go in there, head down, arms up, you charge into the barrier, and you blast it out of the way, and you move on to the next stage. But I think the understanding that I had suddenly become a caregiver did not come until many, many, many days afterwards, when life started to change, when I had to cancel meetings and my social events, when I had to start managing a calendar because of appointments that were coming through from, all sorts of directions. And Jane was not able, willing, or capable of managing those. She wanted me to do the mundane stuff. And I understood that. And I was happy to take that role on. But I don't think it hit me that I was a caregiver until many, many, many days afterwards. At first, I just thought I was, I was just the leader. I was just, the guy in charge of making things happen. And maybe Sharon, your good lady, to a certain extent, took up that role on the basis of seeing you maybe clouded over in the face and, your brain shut down. She didn't have a choice, did she? Your reaction created her reaction, I would think.
Yeah. I think that's fair, because if I'd have been that positive person, accepted the cancer and said, right, we're going to get ahead, it would have been totally different. But me, I had, my mum and dad both died of cancer. My goddaughter died of cancer at 21. Cancer and death has been all around our family all the time. And everybody I'd ever known who got diagnosed with cancer had died. Nobody has survived. So, of course, when I got told I'd got cancer, I'm just going to die. And that's the last thing I wanted to do. I hadn't been long with Sharon. We had a great life, and all of a sudden someone's telling me I got cancer, which means I'm going to die. So that was the scary bit from me. I didn't know there was any coming back from this. So that's the hard part when you hear that. But yeah, I think everyone deals with it differently.
Did you at any point feel that Sharon was your caregiver, although she may not have recognized it at that moment in time? Did you feel that you were being overrun by somebody else taking the lead, or were you happy and pleased and delighted that somebody else was going to ask the questions and take the lead for you?
I don't even remember thinking that. I think I do know now that from the moment I got told I got cancer, my body didn't belong to me. It belonged to the medical people, because I had no education or knowledge to be able to fight back from what they were telling me I had to do or couldn't do. I think Sharon done a lot of that. So I think, at the end of the day, it is, you get diagnosed and everyone deals with it differently.
So at what point did you feel you sort of came out of the initial shock and began to take in what had actually been told to you?
Maybe 12 months, 18 months.
Oh, really? As long as that?
Yeah. Sharon used to call it, I went into my cancer bubble. And as long as I was in that bubble, I was safe.
So, Chris, it's fair to say, whether you're a patient or you're a caregiver, that diagnosis moment is an impact that you'll never forget in terms of how it changes your life going forward.
Yeah, it's like when Lady Di died, or Kennedy got shot, or, the planes went into the towers. You'll always remember what you were doing at that moment. And I think when you get diagnosed with cancer, good, bad, or indifferent, that's put into your head. And it's in your brain and in your memory, just like one of those. And then it's how you deal with that.
I think it's about time to wrap this one up, Chris. I think we've probably put most of our audience to sleep by now. We'll try and rectify that for our next episode. But I'd like to thank everybody who's listened in today. I hope you've had some helpful, useful information. Please, 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 and I know Chris will support me on this, do those checks. Make sure that you are looking after yourself. Make sure that if you've got any persistent symptoms which are lasting for more than 2 weeks, ring that doctor, knock on that doctor's door, go to your GP and get yourself checked out. Thank you very much for listening. If you've liked us, if you've enjoyed this episode, this podcast, please give us a like on social media. And Chris, give everybody the addresses, websites and email detail so that they can contact us with any questions or queries.
So email info@theswallows.org.uk. And if it's the website, go onto the homepage, click on the podcast banner, and it's www.theswallows.org.uk. Look forward to seeing you all next time.
Thanks, Chris. And remember, everybody, Chris and I are not medical experts. We are just sharing our knowledge and experience with you. You want to know something definitive, go and see your medical experts. That's really, really important. Go to your medical experts. So thank you, everybody. Until next time, take care, stay safe. We'll see you soon.
You've been listening to the Swano's Charity Head and Neck Cancer Podcast. For more information, please visit www.theswanos.org.uk. We hope you'll join us again next time.